The gender equality study emerged out of a few kind of motivating factors. The first was around trying to establish World Vision's contribution to gender equality in communities where we work. So often we might know that there's some good stuff happening and there might be some intended as well as unintended outcomes, but we're not always able to capture what those changes exactly are. A second motivating factor was a desire to strengthen the evidence base for our programming. So trying to show that the approaches that we use are based on proven methods and proven strategies to help reduce inequality. And then lastly, to improve our programming. So learning from what's already happening and looking at how we can improve for the future. We're hoping to strengthen staff capacity in monitoring and evaluation on gender issues so they can be aware of some of the tools and some of the resources, some of the ways of asking and exploring those difficult issues around gender, and that this would be an opportunity also to strengthen our internal capacity and knowledge on how to collect data on this area.
The Nossal Institute for Global Health was engaged by World Vision Australia to conduct a research project looking at whether and how their work is having an impact on gender equality. The study team also included researcher Dr. Cathy Vaughan from the Centre for Women's Health, Gender and Society at the University of Melbourne. The study focused on projects in 4 countries, Kenya, Tanzania, Bolivia and India, that were working to promote the well-being of children and communities in various ways. The Kenya and Bolivia projects were explicitly focused on improving the health and protection of women and girls, whereas the projects in Tanzania and India were area development projects which focus on integrated community development generally. The first country that we travelled to was Kenya, which served as our pilot site for the study. The Marigat Girl Child Promotion Project, based in a rural district of Rift Valley Province, is trying to prevent female genital cutting or mutilation and early marriage so that girls can complete basic education. In Kenya, we used focus group discussions, semi-structured interviews and photography as data collection tools. The Marigat Girl Child Promotion Project is complex and focuses on a highly sensitive aspect of women and girls' lives. And we realised that we needed to develop a broader approach that could measure change across a number of indicators of gender equality, not only within each country, but also across the 4 countries. The team decided to use qualitative methods for the primary data collection. This was because the fieldwork was brief, 6 days in each country, and because World Vision collects a lot of quantitative data, but not necessarily on indicators that reveal the baseline situation of men and women, apart from some data such as participation in education. It was important for the study to hear the community's perceptions of how life was for men and women before the project started, compared to what it was like at the time of the study. Across the 4 countries, we used focus group discussions and in-depth interviews to collect the data. The focus group discussions were facilitated by the World Vision data collection teams in each country. The teams were made up of men and women in order to fully understand family and community life for men and women, boys and girls. After the first round of focus group discussions, we worked with the World Vision teams to identify the relevant gender equality indicators, such as decision-making in the family, access to education, and livelihood opportunities. Because of the need to work across multiple languages, the study team worked through translators to conduct the interviews with selected stakeholders from the community, such as village chiefs, teachers, community volunteers and health workers, as well as government officials, academics and other NGOs. The workshop with World Vision staff that took place at the start of the fieldwork was both an orientation on the study methodology for staff, as well as a formal data collection in itself. In some countries we used freeze frames in the context of the workshop to make vivid and physical the interactions between men and women, especially those aspects which are not explained in the project reports, such as preferencing within families, intimidation and vulnerability, and their psychological impacts. The freeze frame technique is where we give groups a prompt. For example, describe for us what life is like for a 15-year-old girl in Marigat community, or describe for us what the life is like for a 50-year-old man in Marigat community. And groups will depict that for us as a frozen moment on stage, like a frozen role play. And so it's an intimate and subtle and compelling insight on relational dynamics between men and women in the community. These activities were also a learning opportunity for the researchers, allowing us to get a better understanding of the root causes of the challenges that face men and women in the community.
A focus group discussion involves bringing together a group of people with similar backgrounds and experiences. For example, you might get a group of young men from a particular community or a group of older women, and you ask them to contribute to a facilitated conversation about a particular topic. That's the focus of the group discussion. The facilitator will usually have a short list of questions that are designed to open up discussion about issues that a research project is trying to explore. In this study, we asked about the participants' perceptions of changes in the opportunities that were available for girls and boys and for women and men in their communities, and about what things they thought had led to those changes. We also asked about whether there'd been any changes in the ways that women and men relate to each other, for example. Focus group discussions were useful for exploring these issues as they gave the study team the opportunity to listen to a diverse range of perspectives and to hear what things the community members agreed on and where there was debate or difference of opinion. It's important that the person facilitating a focus group discussion is experienced in working with groups of people and that they're good at managing situations where one person might be dominating and others are being very reluctant to speak up, and that the facilitator is a good listener and able to probe and explore issues as they arise. It's also crucial to have at least one other person taking notes. It really isn't possible to facilitate a group and manage all the dynamics of that group to keep things on track and to listen attentively and take notes at the same time. Interviews are very good for exploring topics in depth with a particular person, but can give you limited information about whether the views expressed are widely held by a group or whether they're just one person's perspective. It can be difficult to get as much in-depth information with a group discussion, but what they can do is shed light on the range of views held by the participants, and they're very useful for stimulating discussion amongst the group members, which often means issues are raised that the researcher hasn't thought of and would not necessarily have raised themselves. Depending on the time that you have available and other constraints, it is possible to analyse the information collected using qualitative tools collectively. We were able to do this in Kenya using problem trees. Local staff and volunteers who had been involved in conducting the focus group discussions were able to review the notes taken during the discussion to identify the key issues that community members had raised. These issues or problems were then analysed by the data collection team as a group, with the team going back to the notes from the focus group discussion and using them to identify underlying causes of a particular problem that had been identified, as well as the consequences of this problem. This process provided a lot of insights for the outside consultants. We were able to see how local staff and volunteers interpreted the data, and we were able to ask questions from the team members themselves about how they thought gender roles and relations influenced or were influenced by the key issues that the community had raised. One of the other qualitative data collection tools that can be used to explore people's perceptions of change in relation to gender is photography. Photography is a great way for people to express themselves and to share things that are sometimes hard to put into words. People can literally give outsiders such as ourselves a picture of what gender equality or inequality looks like in their communities. In Kenya, we asked the local staff and volunteers who were part of the data collection team to take photographs in and around their communities to share their perceptions in relation to changes in gender inequality. These photographs and the stories that the team members told about the photographs reinforced the data that was being collected through interviews and focus group discussions. But also sometimes the pictures the volunteers took challenged what people were saying in relation to change and gave a different perspective. As with any method for collecting information in communities, there are ethical issues to think about with photography, and this was a particular focus of our discussions with the data collection team prior to them taking any pictures.
On return to Australia, we typed up the notes. We then reviewed all of the transcripts and coded the data according to themes and evidence of change, and whether or not that change could be attributed to World Vision. The gender equality indicators were a form of coding, and so we analysed and organised our findings according to these indicators. At the analysis stage, we also returned to World Vision project documents and any available data sets so that we could construct recommendations for programming and for organisational support for gender equality. From the research, we have identified that World Vision has contributed to improving opportunities such as access to education, health, and livelihoods for men and women. They have done this in different ways, in some cases by taking an explicit approach to addressing gender equality, and in other cases by working on programs where gender equality wasn't a focus, but they have resulted in positive changes all the same. From the research, we've identified that World Vision has contributed to improving opportunities such as access to education, health, and livelihoods for men and women. They've done this in different ways, but the most significant change was associated with those projects that had an explicit gender equality focus. Through the feedback we received from World Vision staff, it became clear that the process of being involved in the research itself heightened their awareness of the gender inequalities and hardships in communities. This was the case for both male and female staff members. Gender equality is an important determinant of children's development. Children watch how their mother and father relate to each other, and that influences their relationships and the treatment they accept in later life. It can take a generation to affect gender equality change. World Vision's long-term presence in countries makes it an important contributor to equitable community development.
Yeah.